Greetings, esteemed ladies and gentlemen. My name is Dr. Claudine Hingston, and I will be presenting with my colleague, Mrs. Dlamini. Our presentation is titled, South Africa's Other Pandemic Towards a Panacea. I will start the presentation, and at some point, I will hand over to Tandeka. In our presentation, we will start with an introduction of our paper, followed by a brief overview of gender-based violence. After this, we will launch into a discussion on gender-based violence in South Africa and its causative factors. We will end with recommendations on curbing gender-based violence in South Africa. Now, let me tell you a little bit about our paper. The main aim of our paper is to critically examine and to highlight the reasons behind the high rates of violence against women in South Africa. And we also intend to come up with recommendations that can assist in curbing this scourge. This paper will employ a qualitative methodology, and we posit that it is only in fully understanding the causative factors of GBV in South Africa can meaningful actions be taken to curb it. Our paper is underpinned by feminist post-structuralism theory as it explores the ways women are treated in the world and seeks to make changes. Data was drawn from secondary sources, and we use an interpretivist paradigm so to give us the opportunity for us as researchers to air our voices and our concerns about this issue. So I'll start with explaining and giving just a brief overview of what is gender-based violence. So gender-based violence in itself is violence directed against a person because of their gender. And both women and men experience gender-based violence, but the majority of victims are women and girls. That is why at times people synonymously use violence against women. They use it also in line with gender-based violence because of the issue that most women experience gender-based violence. So just the definition here, it says, gender-based violence and violence against women are terms that are often used interchangeably as gender-based violence is mostly inflicted on women and girls by men. And most times it is by men that are known to women as well. So let me just give you a brief outline of the different forms of gender-based violence. You have physical violence, sexual violence, and psychological violence. What is physical violence? Physical violence is the intentional use of physical force to cause harm or injury, disability, or death, and it includes things like pushing, shoving, biting, choking, etc. In terms of sexual violence is a sexual act that is being committed or attempted against a victim who has not freely given consent. For example, forced or unwanted penetration, sexual touching, or non-contact acts of a sexual nature. And the third one is psychological violence. Now, psychological violence can be verbal or non-verbal. So verbal and non-verbal communication used with the intent to harm or control another person mentally or emotionally is what is known as psychological violence. And examples are coercion, control, threats of physical or sexual violence, control of reproductive or sexual health, and exploitation of a person's vulnerability. Now let's talk about gender-based violence in South Africa. Gender-based violence in South Africa has been termed as a pandemic. It is a profound and widespread problem in South Africa that disproportionately affects women and girls. The severity of gender-based violence in South Africa has even been attested to by President Cyril Ramaphosa. He made a statement in which he said that gender-based violence in South Africa should be considered as a second pandemic in the country, as serious as the coronavirus. As a country, we find ourselves in the midst of not one, but two devastating epidemics. So, in terms of South Africa and still on GBV in South Africa holds the shameful distinction of being one of the most unsafe places in the world to be a woman. South Africa has a high rate of intimate partner violence and a high rate of rape and sexual offenses. It must be noted that gender-based violence in South Africa affects everyone, whether young or old, black or white, rich or poor, rural or urban. It affects everyone. It pervades every sphere of our society. Every day, our women and girls are being abused, assaulted, and murdered in South Africa at the hands of men. Indeed, GBV in South Africa is a pandemic in the nation. South Africa also has the unenviable, it is also at times referred to as femicide nation. This is because in South Africa, intimate femicide is rampant. Women are being killed mostly by intimate partners, such as a current boyfriend, a former husband, a same-sex partner, or a rejected or would-be lover. This has earned South Africa the unsavory nickname of femicide nation. So at this point, I will give you some statistics to back up what I've said. So I'm drawing from the latest crime statistics by the South African Police from 2019 to 2020. A total of 53,293 cases of sexual offenses were recorded. And rape was at the top of this list at 42,289. Now, in terms of the rape cases, 18,231 cases of rape were reported from private residences. So it means that even in a private residence, a woman is not safe. Also, educational institutions are becoming hotbeds for sexual violence. 300 cases of rape were reported at schools, universities, colleges, or daycare facilities. Now, in KwaZulu-Natal, Inanda and Umlazi, they have been identified as South Africa's rape capital. This is because they've got the highest rate of rape in South Africa. And this has been attributed to the high alcohol consumption, as the majority of the cases occurred as people were leaving shebeens. Both areas, which is Inanda and Umlazi, they're also in the top 5 stations in terms of murder. In terms of common assault against women, 83,202 cases of common assault were reported. And in terms of assaults with grievous bodily harm, there were cases of 50,859. And in terms of murder, again, of murder of women by intimate partner perpetrators, there were 817 cases. This is a scary list. So from these statistics, you can see how grave gender-based violence is in South Africa. This is just a synopsis that was copied and pasted from the crime statistics survey, which showed a summary of sexual offenses, and it also gave an overview of crimes against women and children. So what are the effects of GBV? GBV affects an individual. It also affects a nation as well. In terms of individual effects, GBV can cause physical or bodily harm, negative psychological effects, severe mental health problems, trauma, anxiety, post-traumatic stress disorder, psychomotor disorders, disability, death, fear of men, dysfunctional relationship, etc. And in terms of the effects on the nation, it says there that GBV takes its toll on South Africa healthcare facilities, as an estimated 1.75 million people annually seek healthcare for injuries resulting from violence. It does take a lot on South Africa's healthcare system, because let's talk about HIV. So just imagine an estimated 16% of all HIV infections in women could have been prevented if these women did not experience sexual violence. Also, GBV also affects reproductive health, because women who have been raped are also at the risk of unwanted pregnancy, HIV, and other sexual transmitted infections, which can affect a woman's reproductive health. As we said earlier, GBV can also affect the mental health as well of an individual. And so over a third of women who have been raped or abused, they develop post-traumatic stress disorder. So we can see that GBV is actually taking its toll on South Africa's health system. Also, there are also economic consequences as well, because the high rate of GBV places a heavy burden on the health and criminal justice systems in South Africa, which has economic consequences. So GBV, in short, it impedes national development as a result of wasted resources that could have been used to grow the South African economy. Now, we want to start having a look at the factors responsible for GBV in South Africa. We've given an overview of gender-based violence. We've also given a summary of gender-based violence in South Africa. We've looked at the effects on individuals and on the nation. We've given a statistics, but then we also need to know what are the factors responsible? What are the problems? So I'm going to start, and one of the main factors is socialization. So I'm going to talk on socialization, and after that, I will hand over to my colleague Tandeka, who will take you through the rest of the factors responsible for GBV in South Africa, and then she will also end with the recommendations that we've drawn for this paper. So in terms of socialization, most boys in South Africa, they have been socialized to believe that they should not be reprimanded for wrongdoings, that they should not take responsibility for their actions, and that they should not express their feelings, and that they are superior to women. Many boys in South Africa have been socialized in this way. They believe that they're the dominant sex, they believe that they're the superior sex, they believe that women are objects and women are there to do their bidding, that women are inferior to them. So many boys have been socialized into this form of thinking. So the message of male superiority and entitlement over women is reinforced in all sectors. It is reinforced through peer pressure, the media, political influences, educational institutions. Of course, it always starts from the home. So it starts from the home and it spills over to all the various sectors within the country. So whilst boys are socialized to be strong and aggressive and not to take no for an answer, girls, on the other hand, are being taught to be passive, submissive and pretty and nice, and not to be assertive. So this is the opposite of what boys are being taught. Boys are being taught that they are dominant, they are superior, they are stronger to women, that they should be aggressive, they should be tough, they should not cry, they should not be empathetic. But then on the other hand, we're telling the girls that they should be passive, they should be submissive to a man, that all they need to do is to be pretty, they should be nice, and then they should not be assertive. This definitely, as Alu states, it does create the perfect scenario for the assault of women, because we are breeding these girls, we're socializing these girls to be abused by our boys. Because our girls cannot fight back, they've been taught to be submissive, they've been taught to be inferior, and this definitely breeds gender-based violence in South Africa, this type of scenario. So socialization is one of the key factors that is responsible for gender-based violence in South Africa. It must be noted that during the lockdown, the COVID-19 lockdown period, there was a surge of gender-based violence against women. In just 1 week into lockdown, there were 2,300 gender-based violence complaints. And this increase has been attributed to the fact that male violators and perpetrators, they were out of work, they were out of schools, they were out of public spaces. Remember that during the period, everyone was confined to their houses. So because of that, women had to stay in their houses for long periods with their husbands or male partners, and which in itself is not a bad thing, but unfortunately, it led to gender-based violence being meted out to a lot of women. And what was the reason behind this? It was believed that because these men were confined to their houses, they were frustrated, and they were bored of being confined in their houses, and they were also worried about possible loss of jobs and income during that time. And some of them were into alcohol and substance use to ward off their depression, and all of that led to their anger being unleashed on the women they were confined in the houses with. So during this period, it must be noted, as I said earlier, that there was an increased surge of gender-based violence meted out to women.
Greetings, colleagues. So thank you so much, Dr. Hingston. So now I'll be continuing from where Dr. Hingston ended off. The next factors we are looking at is toxic masculinity. So in line with socialization, many boys in South Africa, toxic masculinity is rooted in our patriarchal and socializations that we experience in our societies. Toxic masculinity comprises of both negative ideals of masculinity, such as violence, lack of emotions, sexual aggressiveness, and dominance over women. So it's the way males are dominantly taught to treat women in comparison to how females treat men. So most South African males have been socialized within this form of masculinity. They display a strong need to control women. Because of this, is considered essential and is affirming their masculinity. So this is how males would act in terms of how they liaise and how they react to women. So in order to control women and to show their power, men perpetuate domestic and sexual violence against women and even against men who do not measure to their standards. So this behavior is also common amongst males themselves, whereby they are comparing themselves and when they want to exert certain power even over other males as well. Overcompensation through risky behavior is another one. So men who display this, they do this through often they avoid behaving in a manner that can be vaguely perceived as feminine and are very daring and aggressive in affirming their manhood. So poor conflict resolution mechanisms is also how toxic masculinity is reflected. They're also not skilled at resolving conflict in their methods. So without or besides sitting down and talking either to their spouses, if there is a problem, they would be aggressive in doing so. So withdrawal, denial, avoidance, and low concern of their needs of other people as well as male figures. We are continuing with the factors. The next is gender inequality and patriarchy, again, which is common and very prevalent in South Africa. Although the South African Constitution grants equality to all regardless of gender, culture, South Africa remains a very patriarchal society and inherits gender inequalities. This is evident in many things, in our households, in our communities, in our organizations as well even. So this is a belief in male superiority and manifests in men feeling entitled to sex with women, strict reinforcement of gender roles and hierarchy, punishment of transgressions, women being accorded low social value and power, masculinity being associated with control of women. The upholding of cultural and patriarchal norms and beliefs that views women as the weaker gender results in men display of power, often in aggressive and violent ways. So it's never in a way that is subtle and in a way that is caring, for an example. It's awful in a very forceful manner. So inequalities in other sectors, such as the education and employment, also fuels gender-based violence in South Africa. Economic disempowerment of women, for instance, goes hand in hand with the prevalence of GBV, as it makes women economically dependent on men, thereby reducing their agency to resist GBV. The norm is that women would stay with abusive spouses or abusive partners because they are economically dependent on them and it's hard for them to break away from those relationships. Again, the next factor we looked at is absent fathers. Again, it's a sad reality that we are faced with in South Africa. Is that South Africa is the highest rate of absent fathers and low rates of paternal maintenance for children in the world. This is a shocking fact. The fact that most children in general, and especially most male children, grow up without a father figure. So more than 50% of children in South Africa grow up in families where their fathers are absent. The state of father absenteeism and low participation in the lives of children as a societal malice confronting South Africa as a nation at this present stage. And this is going at an escalating state as it is in South Africa. So there's a high dependency of boys growing up without involved fathers to develop hyper-masculine behaviors. They are unable to get to know about manhood and how they should treat and respect women. They become aggressive and emotional inabilities because they do not have any male figure to guide them and teach them accordingly. So which eventually escalates into violence against women, sadly so. The next point we looked at is the lack of role models, which is closely linked to the lack or absent fathers. So closely connected with absent fathers in South Africa, absent male role models at home, children, boys tend to idolize and emulate men in their communities. So these men in the communities could not necessarily be good father figures, for an example. They would look at people at television, for an example. They could also look at celebrities, and these celebrities won't also actually, in some cases, be necessarily good examples for them. So sadly, there's a scarcity of suitable male figures to teach and instill good positive manner practices into younger or growing boys. Most boys end up emulating men who objectify women and focus on boobs, according to Naidu. This was an article that was written last year. So the absence of fathers or positive male role models in turn leads to emotional disturbances, aggression, violent behavior, vulnerability, drug abuse, socially transmitted diseases in boys, because these boys grow up without knowing necessarily how do you transition from being a boy into being a man in a society who is living with women. We are moving on. So changing gender roles in South Africa. So there have been many social, economic, and political changes in South Africa over the years, like we know, which has challenged the notion of leadership and men inherited. So women empowerment is a big one in South Africa that the government itself is trying to grow. Women empowerment has made men feel alienated and emasculated. Some of them. They are caught between the form of masculinity they know and the emerging new gender forms prevailing in present-day South Africa. These men don't know how to coexist, so to speak, in our South Africa, where women are as equal as men, where women and men are doing the same jobs, for an example, are earning the same salaries. This becomes a problem. So they feel anger and resentment towards women for anything they deem emasculating, such as women becoming breadwinners. Again, this is a big one. This perceived disempowerment of men is characterized by the need to gain more power over women. This in turn leads to a subsequent rise in gender-based violence, because these men now, they don't know how to act, they don't know how to react when you are the husband and you're at home and your wife is the breadwinner. It's a change and a shift in role. They become aggressive, they become violent and toxic as well. Competition as a result of limited resources is also a problem. Women are increasingly entering into traditional male spaces and attaining leadership position. Men in South Africa, therefore, to compete for limited resources, position, and jobs with women. This pressure to compete and uphold dominant masculinity often leads to aggression and violence again. Like I said, these men, they don't know, they are not taught at least, so they're not trained in terms of how do you now deal with coinciding and coexisting with women even in the workspace. Another one we look at is misogyny. So although misogyny describes strong prejudice against women or hatred of women, it also denotes a discourse of ideology that legitimizes and maintains women's subordination. So that is the men on top and the woman as a subordinate of the male. So many men in South Africa are misogynistic, okay, without even realizing it. This is common behavior that you will pick up in the way men act, in the way they react to some situations and they behave towards women. They do not feel that they're demonstrating hatred towards women because it could be very subtle. It doesn't need to be loud and necessarily scream out that you are misogynist. So their behavior and words, however, expose prejudice, disdain of, and hostility to women, and this in turn derives gender-based violence. So gangs is the other one, or is the other factor. Gangsterism is very prevalent and very rife in South Africa. So the gang culture includes violence against vulnerable people, which is women and children, dominantly again in South Africa. Alcohol and drug is the next factor. Again, this is a rising socioeconomic challenge that we have as a country. So we are saying that the spread or the use of alcohol and drug in South Africa is also a leading contribution when it comes to gender-based violence. So many studies show that alcohol and drugs are one of the leading causes of GBV. This is because we are saying that when people drink and when they are intoxicated, they tend not to behave as themselves. They tend to be aggressive. They tend to be more violent even. Malpunishment or no punishment for perpetrators. The punishment for perpetrators of different forms of gender-based violence is rarely strict or severe in the case of South Africa. So most perpetrators end up getting a light sentence. They'll spend a couple of months, maybe a couple of years, and then they'll be released from the system. Men rape or abuse women with impunity, knowing that their punishment is not severe, and some even escape. And the norm is that they would go into jail maybe for a year or two, and they'll come out and they'll keep practicing or do the same thing again. So now, this is just a summary of what we have looked at in terms of the causes. We looked at the patriarchal society, we looked at gender power inequalities, toxic masculinity, socialization of boys, with Dr. Hingston talked about misogyny, alcohol and drugs, poor male role models, gangs, mild or no punishment of perpetrators, absent fathers, lack of role models, changing gender roles, competition as a result of limited resources. We are not saying that GBV or the factors or the causes of GBV are mainly or is limited to the but these is what we saw as the main causes of gender-based violence. So just to briefly touch on what South Africa, the South African government, is doing as a response to address and to combat gender-based violence. So the response services aim to help survivors of violence in a variety of ways. For instance, medical help, psychological support, and shelter, prevention initiatives to prevent gender-based violence from happening. So this is some of the responses that have been happening. So in response to gender-based violence, the South African government has done the following. So the first is the National Strategic Plan on Gender-Based Violence and Femicide. This came about with the increasing rise of gender-based violence in the country. So government and civil society's multi-sectoral strategic framework to realize South Africa that is free from gender-based violence and femicide. The next is the creation of the Gender-Based Violence Command Center. It operates a national 24-hour, 7-day-a-week call center facility. This facility employs social workers who are responsible for call taking and call referrals. The center is able to refer the calls directly to South African police services and field social workers who can respond directly to victims of GBV. So despite the above efforts, various stakeholders, gender-based violence still continues to be a pandemic in South Africa. It is still increasing, it is still rising. The next slides will provide recommendations on ways in which we feel that we as a country can address gender-based violence. So the fight against gender-based violence is on the increase. The various sectors are working together, which is the communities, educational sectors, religious institutions, as well as the civil societies, the private and the public sector, and as individuals as well. So the first we are proposing is engagement with boys. So at the level when the boys or the males are still very young. So there's a need to engage with boys as they are the ones who grow into violent men who abuse women. They should be engaged with in order to help to change the negative masculinity attitudes and behaviors, to renegotiate their social position and identity. They should be enabled to express their gender positively and practice in a much positive and healthier way, as opposed to being violent and aggressive towards women. So changing the socialization narrative is also very important. Socialization narrative of boys must change from them being socialized on being the dominant, stronger sex and having power over women to viewing them as equal partners. So this could be done again from a very young age. So girls should be socialized in terms of their relation with the male sex. the change must start from at home. So the way you would treat your girl child versus the way you treat your boy child should really be the same. You should groom them up in a manner so that they understand that they are equal. They are both human beings. They both need to be respected as such. So at home, you start by grooming them, like I've just said. You start by showing boys that they should be caring, that it's okay to be emotional and to share their feelings with words rather than being abusive and violent. They should also be taught to respect and care for women, which is instructed as gender equality in terms of human rights. Girls should be taught to see men as their equal and not necessarily as their superior. In attempt to change the socialization narrative at home, it is very important for parents to be part of the changing process. So you start them young in order to change the next generation. Educational institutions, comprehensive sex education in the school curriculum should be taught in all schools to provide learners with the knowledge, attitude, skills, and values to make appropriate sexual choices and behaviors in a less toxic way. So the male shouldn't feel that they have the right, for an example, to demand sex from a woman. Religious institutions and communities should devise multi-level programs. Again, this is where communities are. They are located in our religious institutions. So they should devise multi-level programs that seek to positively integrate boys into society and change the ways that they view and express themselves. So this could be done through mentorship roles, role model program for boys, conversation discussion session whereby maybe the older men speak to these boys to encourage boys and men to express their feelings and emotions and not to blindly follow toxic gender roles. So they should aim to be different in comparison to their previous generation. The next one is engagement with men. So since men are mostly the perpetrators of GBV, obviously they are not the only one, but this is the dominant cases. So programs that involve men in developing alternative masculinities to promote gender equality behaviors should be devised. So such programs should take into account the inequalities and injustices in the lives of females. They must promote culture of women rights. Men should also be instructed on different methods of resolving conflict that does not include violence. So the pride and should be encouraged to view women as equal again, not as the enemy and not as their subordinates. Campaigns should be devised and developed which aim to encourage boys and men to create new, healthier discourse regarding masculinity. So you could still be a man and you could still be muscular, but not necessarily be violent and aggressive towards women. Intensified media campaigns is very important and very necessary. So to increase awareness on gender-based violence and promote prevention as well as responsive initiatives, which is what we need in South Africa. Responsible use of alcohol and drug campaigns. Let people know that you could drink responsibly. You don't necessarily need to drink and be violent at home. Safety, awareness, and campaign sensation, targeting girls and women, such as walking in numbers, walking away at first sign of violence. So this is just as women, sadly, we need to have these type of awareness as well so that we are able to act and always be aware and cautious of where we are and of our environment. Continuous awareness raising initiatives such as slogans, hashtags, even songs, for an example, which happens every now and then, but probably not in the manner that it should happen in our country. So for an example, My Enough or I'm Enough campaign that happens, the Black Thursdays that we've seen, Am I Next, all those type of campaigns. Stricter harsh sentences for rapists would also perhaps help. So this would deter perpetrators from committing gender-based violence acts because they know that as opposed to them spending a couple of months or just a year or two in prison, it would be longer. So this could be achieved through maybe a lifetime sentence or rapist branding even, whereby if you were in prison and, for an example, you got a certain tattoo or a certain mark that we could see you, even when you come out of prison, that this person was a rapist and we know how to act accordingly. Individual initiatives. As individuals, we need to play a part in fighting gender-based violence. So it is everybody's responsibility, both males and female as well. We should all be involved in fighting this on a day-to-day basis. We need to remember that we could be the next victim, or the next victim could be your daughter, it could be your aunt, it could be your niece, it could be your mother, it could be anybody that you know. So let us all do what we can to end GBV. aggressive tactics, this could be through the GBVs or pandemic that must be fought. So some level of aggression is needed. So we are saying that the government itself must try to instill all these recommendations that we've talked about, but just try to be more harsher and more aggressive, like what's happened with fighting COVID-19. Perhaps the same rules could be instilled by the government, so that we try to really address GBV in South Africa. So tough rules and regulations put into place to minimize the spread. So the same tactics should be done and employed in dealing with gender-based violence. This could perhaps help to minimize, if not eliminate, GBV altogether. So intensified efforts should be made by all stakeholders in coming up with initiatives that will curb gender-based violence in South Africa, and hopefully again eliminate gender-based violence completely, because it's a sad reality that we are living with at this current time. So we are saying enough is enough. Let's all strive to try and address and end gender-based violence. Thank you so much. Keep well.